Hello, everyone, and welcome to our webinar, From In-House to Outsourced, Transforming Clinical Administration. My name is Maral Thanasian, and I'm the Director of Client Success here at DoctorCare. Joining me today is Ritesh Daya, the founder of our partner company, ClinicLine, who will be our presenter for today's session. We're also pleased to have Dr. Andrew Velathotam, a longtime ClinicLine customer, who will share his experience with outsourced clinical administration and how it impacted his practice. So let's get started and explore this exciting topic together. To begin, let me introduce you to ClinicLine. ClinicLine are the experts in finding and training skilled remote medical assistants who seamlessly integrate into your clinical team. With over a decade of experience working with hundreds of clinics across Canada, ClinicLine has developed a tailored solution for clinics that takes the hassle out of recruitment, training, and payroll. They handle it all, ensuring that your clinic gets the most qualified staff. The best part? This solution saves clinics an average of 35% on annual overhead costs, and clinics no longer need to worry about turnover, terminations, or ongoing training. ClinicLine manages all of it. Many of you already know what DoctorCare does, but for those who don't, DoctorCare is the largest provider of billing and practice support to over 3,500 physicians across Canada. On average, we have helped doctors recover $25,000 to $30,000 of revenue per year. We also support approximately 25% of all FOs in Ontario. Our solutions and services are designed to help doctors optimize their practice, maximize their revenue, and improve patient care. All attendees are in listen-only mode. We are recording this webinar, so it will be available to you after the event. If you have any questions during the webinar, please submit them in the Q&A feature, and we will try to answer them at the end of the webinar during the Q&A sessions. If we are unable to answer your question, one of our team members will follow up with you after the webinar. Running a clinic in today's healthcare landscape is more challenging than ever, with rising operational costs, hiring difficulties, and increasing administrative burdens. But there are solutions out there, and today we're going to explore one of the most effective: outsourcing clinical administration. During today's webinar, we will explore practical strategies to transform your clinic's administration by leveraging remote medical assistance. We'll begin by discussing the challenges clinics continuously face and share some insights from a recent survey that ClinicLine conducted with a group of physicians. Then we will look at how outsourcing can help reduce clinic costs, from minimizing staffing expenses to cutting operational overhead. Next, we'll cover how outsourcing administrative tasks can enhance your clinic's efficiency, allowing you to focus more on patient care. We will also have a special guest, Dr. Andrew Velathotam, a longtime ClinicLine customer, who will share his experience of using remote medical assistance. Finally, we'll look at other tools and techniques you can use to streamline operations, including automation and billing support. And we'll close off the webinar with our Q&A session. So let's get started. Ritesh, why don't you speak to us about our topic?
Thank you, Maral, for the introduction. Hello, everyone. My name is Ritesh. I'm here on behalf of the team at ClinicLine. We're going to dive into some of the key challenges that clinics are facing and how these challenges are leading to physician and staff burnout, increasing financial pressures, and impacting patient care. When we look at the list of healthcare industry challenges in 2023 and 2024, staffing tops the list. Staffing challenges and high employee turnover are the central factors driving burnout, according to the CMA and the MGMA, the Medical Group Management Association. Recruiting and retaining skilled staff is not only expensive, but time-consuming. And when staff leave, it creates gaps in clinic operations, leading to delays and disruptions in patient care, and at a time when millions of Canadians are struggling with access to healthcare. Think of a typical clinic that relies heavily on one or two administrators. If one of them leaves unexpectedly, it can take weeks, if not months, to find a suitable replacement. During that time, other team members are stretched thin, leading to burnout and an unfortunate subsequent decline in the quality of service and care your clinic provides. For Canadian clinics, high employee turnover and the resulting administrative burden put significant pressure on finances, physician time, and effective patient care. Tackling staffing and high turnover rates will be critical for clinics across primary care, specialty medicine, and allied health. Related to this, another significant challenge that clinics are facing are the rising operational costs and overhead. Whether it's the increasing cost of office space, technology, or salaries, it can feel like you're constantly trying to keep your head above water. To tackle this issue, many clinics are turning to cheaper part-time administrative support, which provides immediate relief but longer-term hardship. And to be fair, this is understandable since there are no reliable solutions at the moment for clinics. Clinics need to be aware of the immediate and downstream costs of high turnover. Immediate costs include the financial expense of recruiting, hiring, and training new employees, as well as the cost of temporary filling staffing gaps. As for downstream costs, they include reduced productivity as clinic managers, nurses, and physicians shift their attention to hiring and as new hires get up to speed. A less tangible but still significant turnover cost is lower employee morale, as those who remain work harder to fill gaps to provide temporary coverage. And what makes this role so difficult to fulfill? A central contributor is the complexity associated with clinical administration. Medical administration, administrative tasks, they're complicated and complex. They require strict attention to detail, as even the smallest mistakes have life-threatening complications and implications. They vary in scope, time, and urgency. They must meet regulatory requirements and privacy concerns. They require coordination across multiple clinical roles, and they require handling complex patient requests, disparate scheduling, and adapting to ever-evolving healthcare technologies. It is easy to understand that this is not a simple role. According to the Government of Canada, almost 40% of medical administrators work part-time. This is chiefly due to the fact that clinics cannot find qualified full-time administrators. Clinics often experience high turnover rates when patient-to-staff ratios are unbalanced. This not only affects the quality of care, but can also lead to patients losing trust in their healthcare provider. When patients feel they aren't receiving the attention they deserve, it can harm the clinic's reputation, cause frustration, and lower staff morale, creating a cycle of challenges for the entire practice. We wanted to dive deeper into this, so we took a survey of over 150 clinicians in Canada, and the results were revealing. 95% of doctors say their staffing costs have gone up by as much as 25%, with more than 80% of doctors reporting 1 to 2 unplanned monthly staffing absences each month. And how is this affecting patients? 3 in 5 clinics reported that their patients have difficulty connecting with their office over the phone. Additionally, 90% of clinics have had staff turnover in the last year, with an average of 5 staff turnovers in the last 24 months. These numbers are alarming, and the CMA has reported that this is a widespread issue. High turnover, staff training, and reliability have been ongoing pain points for clinics, often without a dependable solution. The first question that comes to mind for me is this problem specific to clinics? And the answer is no. This has been a concern across industries and across Canada. So how have other industries overcome these issues? Is this a solvable problem? The answer is yes to both. This is a solvable problem, and the best part is we can look to other industries for best practices on how to effectively solve this. The solution is to take advantage of access to global talent and leveraging technology to introduce remote team members. This is known as outsourcing, and it's been a powerful solution in other industries. We're going to explore how this approach can be applied to your clinic. Outsourcing central administrative responsibilities can significantly improve the efficiency and stability of your practice. For example, in the US, clinics have successfully outsourced administrative support and back office functions, streamlining operations and reducing costs, all while maintaining high service standards for patients. Up until now, Canadian healthcare has lagged behind in adopting this model. But finally, there are now solutions designed, tailored, and secured specifically for Canadian clinics, offering the same advantages. So what does access to global talent look like? And who are remote medical assistants? These are the professionals located abroad who are trained to perform the same administrative tasks as your in-house staff, but can do so remotely, offering your clinic a level of flexibility and convenience that's hard to match. These professionals enter the global employment market looking for stability, meaningful work, and competitive pay. Remote medical assistants can handle a range of administrative tasks, from taking phone calls to patient scheduling, updating records, faxes, referrals, and the list goes on. They work seamlessly within your team, integrating into your existing systems and workflows to ensure nothing falls through the cracks. So what are the key advantages of utilizing remote medical assistants? The first obvious advantage is the reduced burden on both physicians and their support teams. By finding reliable and qualified support to take over these tasks, like inbound and outbound calls, scheduling, follow-ups, faxes, etc., they free up valuable time, allowing your clinic to focus more on patient care and less on administrative bottlenecks, especially when these administrative tasks can be handled more effectively and more reliably by an outsourced team member. Managing these tasks remotely becomes an obvious choice. Beyond access to the global talent pool, one of the biggest advantages of using remote medical administrators is the cost savings. Outsourcing provides significant cost savings while still being able to pay your team members highly competitive wages. This means paying less for more qualified staff. When we crunched the numbers, we saw that clinics in Canada save approximately 45% on overhead costs in the first year. This translates to approximately $30,000 per administrator. The standard clinic's hiring process typically involves posting, sourcing and screening candidates, conducting interviews, performing assessments or reference checks, submitting an offer and negotiating, onboarding, and finally training. Overall, the process can take anywhere from 3 to 16 weeks, depending on the urgency and quality of the candidate pool. All this to say is the time you and your staff spend on this process is both time-intensive and expensive. Have you calculated what recruiting, hiring, and training costs you in time and wages? The next benefit is flexibility and scalability. With remote medical assistants, you can scale your staff based on your clinic's current needs. You can quickly add more support to your team as your practice grows without the headache of hiring, training, and managing new in-house staff. Moreover, part-time options allow smaller clinics to take advantage of the benefits associated with outsourcing. Having a remote medical assistant support your clinic during peak hours, weekend, or after hours is a huge benefit and reduces the burden on in-person staff. The other critical piece is terminating employees when the fit isn't right. I have heard time and time again of the legal nightmares that clinics and doctors are in when they're terminating a contract of an administrative team member who was just simply not the right fit. With outsourced solutions, this is no longer a concern or challenge. You have the flexibility to remove a bad apple as soon as it's apparent. Your contractual relationship in most cases is with the outsourcing company, not the employee. At ClinicLine, we've taken the success of the outsourcing model and customized it for Canadian clinics. We focus and specialize only in clinics and only in Canada. We have over a decade of experience in Canadian healthcare, and we know the administrative intricacies associated with local clinics and their workflows. More importantly, we know what it takes to develop the modern clinic. The modern clinic is the right combination of in-person and remote staff. It is the right combination of gold standard best practices and customized workflows, because we understand that every clinic is unique. ClinicLine was designed for busy doctors and overwhelmed clinics. We do all the recruiting, interviewing, and hiring. We also take it a step further and do all the training. ClinicLine medical administrators are trained on all the major EMRs and supporting softwares. They're trained on Administration 101, which includes things like dealing with difficult patients, being efficient on the phones, triaging urgent cases, and dealing with emergency cases of suicidal patients. We do all of this Administrative 101 training for you. We then work with you to train them on your specific preferences. We develop detailed training guides and protocols that we use to ensure your staff are always performing at the best in your clinic. We'll provide you with those training guides as well, so you can use the same material to train your in-person staff. Additionally, we manage payroll, benefits, and compliance, so you no longer have to. And the best part is we're always there to help, whether it's an additional level of management required, staff coaching, or workflow optimization. We've helped clinics across Canada enhance productivity, seamlessly integrate, and maximize the value of remote medical assistance. So what kind of work can our remote medical assistants do? Everything. Everything with the exception of engaging with the patient face-to-face and scanning a physical document. Our assistants, remote medical assistants, can do it all. This includes scheduling and confirming appointments and referrals, updating patient demographics, charts, and files, managing all inbound and outbound calls, preventative care follow-ups and reminders, fax management, digital filing and annotation, uninsured billing processing and follow-ups. All of our team members have undergone a rigorous 4-week training program, covering all day-to-day tasks required of a medical administrative team member. Following their training, they are placed in one of our 12 partner practices where they receive real work experience before being placed with the clinic. At ClinicLine, we have no long-term commitment. We are confident in the value you provide, and we only want to work with you as long as you're finding value in the service we're providing. We understand that clinics of different sizes require different levels of support, so we offer both full-time and part-time options. We offer a backup administrator model for no additional cost. Our backup administrator model means if your dedicated team member is ever suddenly away or on vacation, we will have a backup team member who is trained specifically for your clinic. So your clinic will never experience a disruption. There will never be a day where your phones aren't being supported, your faxes aren't being filed, and your patients are not receiving support. This is the enhanced value proposition of working with ClinicLine. So, all this sounds great, but is this secure and private? Does this meet FIPA compliancy? The answer is a resounding yes. To ensure outsourcing works for Canadian clinics, we made it a priority to put together a technology stack that uses industry-leading privacy and security technology. This means your data never leaves Canadian servers, passwords are updated and changed every 30 days, and the staff we hire are vetted and continuously monitored. We are fully FIPA and HIPAA compliant. This way, clinics can feel comfortable knowing their patients' data is secure and their privacy is taken seriously. At this point, I'll turn it over to Dr. Andrew to tell us about his experience with different formats of outsourcing, his experience with ClinicLine, and his advice for physicians considering remote administrative support. Dr. Andrew runs a very busy family practice in the Greater Toronto area. Welcome, Dr. Andrew, and thank you for taking the time to speak with us.
Thank you. Thank you for having me.
Dr. Andrew, so just before we start, tell us a little bit about your practice.
Yeah, absolutely. So as Ritesh said, I have a very large practice in the Greater Toronto area, very diverse, multicultural, and we have a high need of patients. I think in our clinic, we average about 100 to 150 calls a day. And our journey actually started with ClinicLine almost a year ago now, when we had to actually move clinics. And it was quite a daunting task because at that time, I only had one staff that was really moving with me. And I knew one of my biggest pain points was going to be my phones. And when I spoke with Ritesh, he spoke to me about ClinicLine, and it just sounded like this was the right fit for my clinic, or something at least to try out. Prior to ClinicLine, I would say my phones were probably the biggest pain point I had from myself and my patients. Getting through to our clinic, trying to make an appointment. Every time, I would say every day I would hear a complaint. So I knew once I moved clinics, I knew this would just be even a larger problem. So ClinicLine proposed to me that you won't have to worry about your phones anymore. And to be honest, it was a shot in the dark, but I knew I had to take it. And I must say, a year later, I couldn't be happier. It really worked out well.
That's great to hear, Dr. Andrew. And when you were going through this, idea of exploring other options other than the standard, traditional in-person support, did you find there were a ton of other options? Was there anything else you were able to explore?
Yeah, so it's a good question because prior to me moving, I did have another company that we did use to try and do this outsourced piece before and have a virtual admin, let's say. But the model that they proposed and why it wasn't as successful is they had more of a call center model. So what would essentially happen is we would have multiple admin answering phones and became kind of inconsistent. And it ended up being patients were on the phone a bit longer than expected because it was different admin answering phone every time. They didn't really understand how our clinic worked. So that kind of left me with a bit of a sour taste on outsourcing. So obviously I had a little hesitation in the beginning with ClinicLine, but I think what sets ClinicLine apart is that because there was a dedicated staff, knew our clinic, knew how we operated, it definitely made a big difference in consistency and reliability. So that, I think that was a huge advantage.
Yeah, and Dr. Andrew, you're not alone in that. When we've spoken to other physicians, they have tried call center models or call answering services, and they just don't work for clinics. You need somebody that knows your preferences, that knows your patient population. It's critical to have a dedicated team member.
Absolutely. Yeah, absolutely. Yeah.
And you mentioned, this left you with some reservations with, using, remote medical assistance. Did you have any other reservations, with regard to remoting this type of?
Yeah, I think for sure, and you brought it up, privacy was always a big thing. When you're doing something outside of Canada, you get very worried about our information and how private and how secure everything is. But like I said, 1 year later now, I don't think that's ever been an issue at all. I'm also taking into account that, I mean, I use Akiro, so they're logging into our cloud-based EMR. That data is staying there, and then they're essentially just inputting everything into that. There's nothing, it's not really going anywhere else. So I think for that respect, and based on where we have technology now that's cloud-based, remote, it's no different than me logging into my laptop when I'm on vacation somewhere else and doing work as well. So I think that was one part of it. The other big part, I think everyone was also, I got worried, or you think about, is the proficiency language in terms of English proficiency, competency. Again, I don't think that was an issue as a whole. I would venture to say language proficiency maybe even better than some of my staff that I have here. So I don't think that was an issue as well. I would also say one thing that really helped me out when I had to move the clinics was, and I'll speak to the point that you said, the reliability and dependability of not having to worry about someone calling a sick day. Right. So, at the same time that we had the phones, we had to get people on the phone, we had remote staff, I had to hire all new staff in-house. I probably went through 4 to 5 different people in my clinic before we found the right fit and had someone that we was reliable. I never had to worry about the phone part. And I actually never knew if anyone was sick or anything like that, because every day the phones were being answered. So that was probably one of my saving graces when moving a clinic, that I didn't have to worry about that aspect. So that was definitely helpful.
Yeah, that's great to hear, and I'm glad to hear you didn't notice.
Exactly.
And Dr. Andrew, when we think about the modern clinic, which is a combination of remote staff and in-person staff, can you kind of just give us a breakdown of how you've organized your clinic with regard to in-person and remote staff and the tasks that you've allocated to each?
Yeah, absolutely. So obviously the first part was phones. Definitely, you can do that remote. That's not an issue. So my journey with ClinicLine essentially was, we wanted to take care of the phones. We wanted to make sure we were reliable, which was great. And then I think as we got into maybe 4 or 5 months, I realized that this service was really helpful. And I think we shifted now then to doing tasks. So that included doing the tasks of callback for patients, doing faxes, following up on referrals. Basically any task I would send my staff, I could send to ClinicLine as well. We got it to a point even now, so I almost have 4 or 5 staff now, where when I send out a task, it includes not just my in-person staff here, but the remote as well. And it's literally just whoever is available will start completing the task. So essentially, I would say ClinicLine staff is part of my team. It's exactly the same thing as if I were to have the staff here. And the expectation is that they can complete everything that any of my staff can do here. The only thing I can't do, obviously, is any in person. All my staff here are trained phlebotomists, but that I don't expect a remote person to do that, right? So, but everything else is up for grabs. And again, it's working quite seamlessly now, because if they're not on a phone, or literally if they're on a phone and waiting as it rings, we got them trained so well now that they can sort the faxes while the phone is ringing. So we have the multitasking. It's actually working out quite nicely.
Great. And speaking to the level of tasks that they're doing and this level of multitasking, how relative to some of the staff that you were hiring and the turnover you had, the quality and the qualifications in terms of how well they're doing to multitask, to do all these tasks, have you found the quality of staff abroad to be equally or better than what you found here?
I think the key thing here, and everyone should understand, is you have to realize people are motivated to work if they value their job.
Mhm.
And I feel like when we provide feedback to our ClinicLine staff, they are very willing to take it and act on it. When I've definitely had staff, in-person staff that are no longer with us, that were not open, and the quality of their work was not there because they didn't value their job. So I would say definitely they're equal to my most proficient staff here, and if not even some better than some of the staff are here, because they value what they do so well, so much. They are always willing to learn and do more and perform. So I think that's a very key point to differentiate between the people we hire here versus when we outsource.
Got it. Okay, excellent.
Yeah.
And then, just finishing up on that, when you think about cost savings and time savings, can you comment on what you've noticed
Yeah, I mean, absolutely. I definitely pay my staff here much more than what we pay versus for ClinicLine. So the cost savings alone is quite good. And then, to be honest, imagine, because we don't ever have a downtime, we're not suffering those points where we get backlogged or things that don't get done and then have to be done later on, because there's not that, we don't notice if there's ever an issue or if they're ever off. There's always backups. So that cost of that aspect of trying to catch up is never really there as well. So you see it with consistency, and we see it, quite frankly, with just the cost is just cheaper than hiring someone here. Yeah.
Got it. And then Dr. Andrew, in terms of, as other physicians are thinking about this, or, they're having a pain point with staffing or costs or whatever it is, what advice would you give to other physicians and clinics when they're thinking about working with an outsourcing company and when they're trying to manage their administrative workload?
Yeah, I think my advice would be, well, first, when you do have an understanding of your pain points, like you said, so understanding the calls will be an issue. Too many tasks can be an issue. I would say this, even when we removed the aspect of our in-clinic staff taking calls, that was a huge stress relief for them here. So everyone's actually a little bit lighter because they know taking calls is probably, I would say, one of the most difficult part of the job. And if you're outsourcing that, you're relieving a lot of the stress within the clinic. So that's one part that I would say. The other point is, when we did engage with ClinicLine, I think you have to also realize, because you're hiring a dedicated staff, you're actually hiring a new staff for your team, and they're part of your team. So when that happens, you have to kind of invest that time to give them feedback. You can watch them a little. So even when we started, we did the Google Meets, and I was able to watch them work for at least 20 minutes, half an hour, provide some feedback. And they also get a sense that they're part of your team as well here. And I would say now our staff are really quite connected now with those there at Outsourced, and they text each other. They text me regularly if there's something needs to be done. So they have an understanding, like, we all working together. The work all has to be done together. And when you incorporate it that way, your clinic runs much more efficient as well. And you're getting that benefit of a high quality staff without you doing all the necessary to interview, to get them, to find these people. They're already found for you. So it is a huge benefit.
Got it. Okay. Any other advice for your colleagues that's worked well for you that you're willing to share?
I would say, now that we have the tech of being able to do things remotely, and where we are right now, I don't think we have to function the way we used to, where we always just had people in the clinic, managing the phones, loading our rooms, and it becomes very chaotic. I would say the chaos has come down in our clinic when we moved to this outsourcing the phone part and having remote staff. The clinic just seems a little bit calmer. And I think when we start leveraging technology and outsourcing, I think it's a better move. And to be honest, it's cheaper too at the end of the day.
Got it.
Yeah.
Excellent.
Yeah.
Thank you, Dr. Andrew, for sharing all of that. That was super helpful.
Thank you.
I'm going to jump back into just going a little bit over what kind of ClinicLine does, kind of following up on some of what Dr. Andrew shared with us. I'm going to share my screen again. Okay. So yeah, thanks again, Dr. Andrew. So what does it look like to get started with remote medical assistance? So I'll go over the process just to give some insight into what that would look like for clinics of all sizes. So the first thing we do is a clinic assessment and audit. We document and review your workflows and protocols, look at every aspect of your clinic's administration. This includes determining which EMR and tools you're using, what languages beyond English are required. Some clinics require bilingual administrators depending on their patient population, which workflows will be completed remotely, which tasks will remain with your in-person staff. Once we finalized all of this, we make recommendations so that we're training the right things and not bad habits. Now we're ready to find the right team member for your clinic. Onboarding starts with recruiting the right team member and introducing them to you. Once you've met your new team member and you've confirmed they're the right fit, we move forward with setting up their contract, payroll, and benefits. Following our internal training, your new team member, along with our training coordinator, will work with you or your staff to train the nuances that are related to your clinic. Each clinic is unique and each doctor has their preferences. We want to ensure these preferences are documented, trained, and continually reinforced by your remote administrator. Following this, we move to live training, where we can evaluate training gaps and if additional coaching is required. After this, we're ready to go, and your team member is ready to support your clinic. In total, this process takes about 5 to 10 business days. Yeah, that's right. In a week, you can have a new team member recruited, onboarded, and trained. The goal for us at ClinicLine is to foster a team relationship. As Dr. Andrew was saying, we want your new remote medical administrator to feel like a member of your team. Clinics have the flexibility to choose our involvement in the management of their new team member. We'll provide ongoing support, whether that's helping with coaching, additional training, or resolving any issues. And if at any time you feel your team member is not the right fit, we will replace that team member, find a replacement, and have them trained and ready to go live. Success for us is seamless integration of this remote team member into your clinical team, so you can take advantage of the qualified global talent, the increased reliability, and the significant cost savings this solution provides. Now, we're going to move on to our final section, and I'll turn it back to Morel to discuss how technology solutions can further help streamline administrative tasks and improve patient engagement.
Thanks, Ritesh. Medical billing is an area well known for its complexity and its nuance. With the Ministry of Health continuously updating and changing billing codes, it becomes another administrative challenge. Many physicians leave significant amounts of revenue behind due to unaddressed billing errors and poorly optimized billing, missing out on their bonuses and other billing opportunities. Every physician can benefit from someone who can help optimize their billings, especially when dealing with errors, outside use, rostering, and maximizing bonuses. Many doctors turn to billing software or apps and manage data entry and claim submissions themselves. While these tools can be helpful, they also increase the administrative burden and the likelihood of errors. Handling billing in-house demands significant time and attention from staff, time that could be better spent on patient care or other operational improvements. Plus, managing billing internally can add to your HR load and increase overhead costs. On the flip side, some doctors opt for full billing services, where external personnel manage all billing operations. This approach means no need for additional software on your end. Ideally, the billing company's systems should integrate seamlessly with your EMRs, allowing billing specialists to handle everything in the background with minimal involvement from you or your staff. The most obvious benefit of using an expert billing provider versus doing it in-house is a significant increase in revenue. It enhances billing accuracy and efficiency, helps minimize claim rejections, and maximizes income potential. If you or your staff are overwhelmed with billing or are unsure whether outsourcing your billing is right for you, Doctor Care can perform a complimentary audit to identify opportunity areas and help you make an informed decision. One of the things that we are most excited about at Doctor Care and at Well Health is artificial intelligence in healthcare. We believe AI holds the key to transforming healthcare delivery, from diagnosis to treatment, ushering in a new era of innovation and efficiency. As we all know, the sheer volume of patient documentation doctors encounter on a daily basis can be overwhelming. AI medical dictation and ambient scribe are game changers in the realm of healthcare documentation. By automating transcription and real-time note-taking, these tools empower clinicians to focus on patient care rather than paperwork. AI medical dictation uses natural language processing and speech recognition to transcribe speech into text and format it according to the required standards and templates. Ambient scribe is a technology that goes beyond dictation and captures the entire patient encounter using ambient sensors like microphones and cameras. The AI system examines the data and produces a comprehensive and structured summary of the encounter. Some ambient scribe technologies, including, AI voice solution, go a step further by automatically creating SOAP notes in your EMR. The statistics shown on this slide are based on a pilot conducted with OMD, and the positive effect of the day-to-day use of ambient scribe is quite significant. Now, let's look at some options for automating some basic patient engagement tasks. In 2019, the ministry launched its new Digital First for Health strategy for Ontario. In March 2021, they released their service standard for online booking. Online booking allows patients to book an appointment from any device, anytime. Automating patient scheduling through online booking decreases the volume of email and phone calls and frees staff to focus on other priority tasks. Automated reminders also help reduce no-shows. According to Canada Health Infoway, 90% of patients prefer self-scheduling. Providing patients with self-service forms is another way to streamline processes and reduce administrative load and errors. Automating forms-based processes such as intake forms, insurance forms, doctor's notes, prescription renewals, school forms, etc., can significantly reduce the effort required by manual processes, improve the data accuracy, limit unnecessary appointment requests, and make actual appointments more about your patient and less about paperwork. When combined with online booking and self-service forms, secure messaging can ensure that in-person visits and follow-ups become more effective and efficient, particularly when everything is integrated into your EMR and automatically syncing into your patient chart. When considering solutions to automate your patient engagement processes, ensure that any online booking, forms, or messaging meet security requirements and can be customized to your clinic's workflows. We are happy to review your workflows with you to find the right solution. As we wrap up today's session, let's quickly go over the key takeaways. First, it's clear that outsourcing administrative tasks isn't just about saving money. It's a smart way to improve how your clinic runs. By using remote medical assistance, you can ease the workload on your in-house staff, streamline operations, and focus more on patient care. Plus, outsourcing gives you the flexibility to adapt quickly without the hassle of hiring or training. Another big takeaway is how technology and global talent can really transform clinic management. Remote medical assistance brings specialized skills tailored to your practice needs, ensuring things are done efficiently, accurately, and in full compliance. This helps maintain stable staffing and cuts down on disruptions caused by staff turnover. Moreover, adopting remote support isn't about replacing your team. It's about giving them the tools they need to be more effective. By removing administrative roadblocks, both your staff and patients can thrive, leading to better efficiency, cost savings, and higher patient satisfaction. And finally, leveraging technology and introducing automation to your administrative processes is the way of the future and will be critical to allowing you to streamline your practice and improve efficiency. As a thank you for attending today's webinar, we would like to extend this exclusive offering to all of our attendees. For a limited time, ClinicLine is offering a free 2-week trial of their services valued at $1,500. This is a great opportunity to see how remote medical assistance can transform your clinic. To get started, simply reach out to us by using the contact details on this slide. Now, we would like to open the floor for your questions. Please feel free to submit any questions you have using the Q&A feature, and we'll answer as many as we can. Ritesh, how many medical administrators does my clinic need? That seems to be a question we're seeing from the audience.
That's a great question, Morel, and not the simplest of answers. So the number of medical administrators will depend on the clinic, the type of clinic, if you're a specialty medicine or primary care physician. So, one of the best ways for us to gauge how many medical administrators make the most sense and are most efficient for a clinic will depend on the number of doctors and the patients rostered. So in a primary care setting, for example, if a clinic has approximately anywhere from 1,600 to 2,200 patients, that clinic will expect to receive about 120 to 140 phone calls a day, about 100 faxes. And what we can say is that one administrative team member can support that workload. That is the most efficient kind of bandwidth that one medical administrator can manage. So when we're looking at a clinic, we'll use those types of metrics and the setup of the clinic to determine the number of medical administrators needed. And then we'll also look at what the right combination of in-person and remote medical administrators will look like.
Wonderful. And then we have some questions about the languages that the team can support. Could you elaborate on the languages, as well as a question tied into that we've gotten is where are the team members based?
Got it. Okay. So those questions are kind of interconnected. So with regard to languages, we've been able to pretty much support any language request that we've received. So we've received language requests for Spanish, Hindi and Punjabi, Portuguese, Ukrainian, Turkish, and we've been able to find candidates that are bilingual that are able to support those languages and English. So there hasn't been a language we haven't been able to support yet. So we welcome clinics to provide us with a challenge, and we're looking forward to being able to support that language for you. And with that being said, we're able to find out talent across different countries in the world. Like I said, we're accessing this global talent pool. So depending on the language requirements, that will dictate where in the world we're finding candidates. But for the most part, most of our administrators are in the Philippines, Albania, and Portugal.
Fantastic. And Ritesh, could you elaborate a little bit more on how the pricing model works and whether there are any fees that a clinic should be mindful of?
Yeah, absolutely. So we've made our pricing very simple. It's $18 an hour flat. There's no additional costs related to that. There's no CPP, EI, vacation pay, none of those additional taxes and fees. It's $18 an hour flat. And then that is dependent upon a part-time or a full-time model. So for example, if you're looking at a full-time, full FTE, which is 40 hours a week, on a monthly basis, that comes up to about $2,800 a month for a full-time remote medical assistant.
Excellent. And are there any minimum requirements for the number of hours that these remote medical administrators can be hired for?
No, there's no strict minimum. We're very flexible in the hours and the requirements for clinics. We understand that clinics have different needs based on your size and based on where you are. You might have different requirements, whether you need somebody just supporting your clinic for a couple hours in the morning when you have peak call volumes, or you're looking for support just for an hour in the morning with some of your paperwork. We're completely flexible on the number of hours that can be supported.
Excellent. And I realize we're on time. So one final question from the audience. Do clinics need to change their phone systems or change anything to accommodate the remote medical administrators?
Yeah, that's a great question. And the answer is no, nothing needs to change. We will work with your current phone systems. If you're using a VoIP system, for example, we're able to simply add an extension. That's the simplest system to use. But if you're using hard lines or other phone systems, we'll use a call forwarding or a call redirection. But no, so phone systems do not need to change. We'll work within your existing system.
Wonderful. Thank you, Ritesh. That is the end of our webinar today. On behalf of Dr. Care and ClinicLine, we thank you for joining us. If you have any questions or have any feedback on the webinar, please feel free to contact us anytime. Our contact information is listed on the slide, and we hope you have a wonderful day. Thank you for joining us today.